cigarette smoking stands as the primary cause of preventable deaths in the United States. Inhaling cigarette smoke exposes individuals to over 7,000 toxic chemicals.
Can you imagine how smoking affects the major organs of the body? Over time, smoking can cause significant damage to the human body. However, the good news is that some of this damage can be reversed. That's exactly what we'll be talking about in this video. But before we get into the details, it's important to clarify that we are not doctors. This video is for informational and entertainment purposes only. Now, let's explore how smoking affects the major systems of the body and what happens when a person quits smoking. Lungs. Smoking has several detrimental effects on the respiratory system. These chemicals can cause inflammation and irritation in the airways, leading to various respiratory problems. Here are some specific ways smoking affects the respiratory system. Chronic bronchitis, emphysema. Lung cancer. Smoking is the leading cause of lung cancer. The harmful chemicals in tobacco smoke can damage the DNA in lung cells, leading to the uncontrolled growth of cancerous cells. Reduced lung function. Worsening of asthma. Increased risk of chronic obstructive pulmonary disease, COPD. Within a few weeks of quitting smoking, your lung function starts to improve. The airways become less inflamed, allowing for easier breathing and increased lung capacity. You may notice a decrease in coughing and shortness of breath. Smoking has a profound negative impact on the cardiovascular system. Increased risk of heart disease. Smoking is a major risk factor for heart disease. This increases the risk of atherosclerosis, buildup of plaque in the arteries, leading to conditions such as coronary artery disease, heart attacks, and strokes. Elevated blood pressure. Smoking raises blood pressure by causing the blood vessels to constrict and by increasing the heart rate. This puts additional strain on the cardiovascular system and increases the risk of hypertension, high blood pressure, reduced oxygen supply. The chemicals in tobacco smoke, such as carbon monoxide, bind to red blood cells and reduce their capacity to carry oxygen. This results in decreased oxygen supply to the body's tissues and organs, including the heart. It can lead to chest pain, angina, and may contribute to heart muscle damage. Reduced risk of heart disease. The risk of heart disease decreases significantly when you quit smoking. Within a year of quitting, your risk of heart attacks and strokes starts to decline. Over time, your blood pressure and heart rate normalize, reducing strain on the cardiovascular system. Smoking has significant negative effects on the immune system, which is responsible for defending the body against infections and diseases. Here are some of the effects of smoking on the immune system. Impaired defense mechanisms. Smoking compromises the immune system's ability to fight off infections. The chemicals in tobacco smoke, such as nicotine and tar, can suppress immune responses, making it harder for the body to recognize and eliminate harmful pathogens. Increased susceptibility to infections. Smokers are more susceptible to various infections, including respiratory infections such as pneumonia, bronchitis and influenza, urinary tract infections, and gum disease. Smoking weakens the immune system's ability to ward off bacteria and viruses, making smokers more prone to these infections. Increased severity of infections. When smokers do contract infections, they tend to experience more severe symptoms and complications compared to non-smokers. The weakened immune system in smokers can result in prolonged illness, increased hospitalizations, and higher mortality rates in severe cases. Reduced antibody response. Smoking affects the production and function of antibodies, which are essential for neutralizing harmful pathogens. This impairment in antibody response makes it harder for the immune system to effectively eliminate invading microbes. Altered inflammatory response. Smoking disrupts the body's normal inflammatory response. It can lead to chronic inflammation, which is associated with various diseases, including autoimmune disorders, cardiovascular disease, and certain types of cancer. Increased risk of autoimmune diseases. Smoking has been linked to an increased risk of autoimmune diseases where the immune system mistakenly attacks the body's own tissues. Examples of such diseases include rheumatoid arthritis, lupus, and multiple sclerosis. It's important to note that quitting smoking can significantly improve the immune system's function and reduce the risks associated with smoking-related immune suppression. Over time, the immune system can partially recover and the body's ability to fight off infections can improve. Effects on females. Reduced fertility. Smoking can decrease a woman's fertility by affecting the quality of eggs and disrupting the hormonal balance necessary for conception. It can also increase the time it takes to conceive. Increased risk of miscarriage. Smoking during pregnancy increases the risk of miscarriage and pregnancy complications, such as placental problems and preterm birth. Ectopic pregnancy. Smoking increases the risk of ectopic pregnancy, where the fertilized egg implants outside the uterus, typically in the fallopian tubes. Ectopic pregnancy is a medical emergency and can be life-threatening. Menstrual irregularities. Smoking can cause hormonal imbalances, leading to irregular menstrual cycles, heavier or painful periods, and earlier onset of menopause. Reduced effectiveness of assisted reproductive technologies. Smoking can negatively impact the success rates of fertility treatments, such as in vitro fertilization, IF, making it more difficult to conceive. Increased risk of cervical cancer. Smoking is a risk factor for cervical cancer. It can cause cellular changes in the cervix, making it more susceptible to human papillomavirus (HPV) infection, a major cause of cervical cancer.
Does smoking affect your kidneys? Have negative effects on the kidneys indirectly. Smoking can affect the medications used to treat high blood pressure and uncontrolled hypertension. In simpler terms, smoking can contribute to high blood pressure, which can ultimately lead to kidney disease. Additionally, smoking reduces arterial blood flow to the kidneys, negatively impacting their function. However, quitting smoking can help reduce or eliminate these negative effects. Nicotine in tobacco is a highly addictive compound that directly affects the nervous system. When a person smokes, nicotine rapidly reaches the brain within seconds and acts as both a stimulant and a depressant to the central nervous system. This leads to the release of hormones like epinephrine and dopamine, which create feelings of pleasure and contentment associated with smoking a cigarette. However, these pleasant feelings are short-lived. After the initial boost, the smoker experiences fatigue, leading to a craving for another cigarette. This cycle of experiencing a temporary high followed by cravings is what contributes to the strong addiction to smoking. In summary, nicotine's impact on the nervous system is the driving force behind the addictive nature of smoking. It creates a continuous cycle of cravings that makes it challenging for people to quit smoking easily. When you quit smoking, your skin experiences positive changes. The chemicals present in cigarette smoke can harm your skin by narrowing arteries and reducing blood flow. This leads to a lack of oxygen and nutrients for the skin cells, causing a loss of radiance and premature aging with visible creases, especially around the eyes. However, once you stop smoking, the skin on your face, neck, and hands starts to show improvement. Yellow stains on fingernails, often seen in smokers, will also fade away over time after quitting, restoring their shine and luster relatively quickly. Similar to its effects on the skin, smoking can contribute to hair loss. The chemicals in cigarette smoke can impact hair follicles due to reduced blood circulation caused by smoking. However, when you quit smoking, your hair begins to regain its fullness and looks healthier and thicker over time. Moreover, the unpleasant smell of cigarettes that lingers in the hair of smokers disappears, and your hair benefits from reduced hair loss and a fresher scent. In summary, quitting smoking has multiple positive effects on both your skin and hair, leading to healthier and more vibrant appearances, making it a valuable step towards Let's explore the effects of smoking on oral health. Individuals who smoke cigarettes are more likely to experience dental problems, including bad breath, stained teeth, gum disease, loss of taste and smell, increased plaque and tartar buildup. and an elevated risk of oral cancer. Bad breath and teeth staining result from the tar and nicotine found in cigarettes. More serious issues such as gum disease and oral cancer are attributed to reduced blood circulation in the mouth caused by smoking. It is essential to note that approximately 90% of people with mouth or throat cancer have used tobacco or are current smokers. The good news is that quitting smoking can lead to a decreased risk of oral cancer and offer benefits like fresher breath, reduced teeth staining, improved sense of taste and smell. Another common question revolves around the link between smoking and breast cancer. Numerous studies have shown an increased risk of breast cancer associated with smoking, especially for women who start smoking before having their first child. One study found that such women are 61% more likely to be diagnosed with breast cancer compared to non-smokers. Although a direct cause and effect relationship between smoking and breast cancer has not been definitively established, the evidence strongly suggests a significant association between the two. Summary: smoking has harmful effects on both oral health and the risk of breast cancer. Quitting smoking can significantly improve oral health and reduce the risk of developing oral cancer, as well as positively impact overall health and well-being. Smoking and mental health. This video has mainly focused on how smoking affects the body's physical organs and systems. However, it's crucial to understand that smoking also impacts mental health. In the short term, smoking may provide a sense of relaxation, which contributes to its addictive nature. However, in the long run, smoking can lead to increased tension, anxiety, and a higher likelihood of depression. If you are a smoker, it's essential to consider whether the short-term benefits are worth the long-term detriments to your mental health. Quitting smoking can alleviate stress, anxiety, and depression, leading to an overall improvement in mental well-being and a better quality of life. While it's ideal never to start smoking to avoid associated diseases and conditions, if you are already a smoker, quitting now can significantly benefit all your body systems, and much of the damage caused by smoking can be reversed. Thank you for watching this video. If you found it helpful, please hit the like button and consider subscribing for more content like this. I'd love to continue the discussion in the comments. Are you a smoker or have you quit? How has quitting smoking affected your overall health and lifestyle? Let me know down below. That concludes this video. Thanks again for watching, and as always, remember to breathe, my friends.